I'm going to go ahead and record this. So thanks for joining us. This is our February webinar. What can a neuropsychological evaluation do for you? I'm Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology, and I'm joined by Dr. Natashia Brown. The two of us, along with Dr. Nav Gill, we are the three neuropsychologists at Small Brooklyn. You can see our pictures down there at the bottom. The other faces that are there are Jill DePietro, Sam Janit, Deidre Edwards, and Maddie Lawler, and they are all wonderful clinicians who do therapy. Our practice is located at Industry City in Brooklyn, and we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, all psychological concerns. And all of us have experience working with people across the lifespan, but we also have special training and experience to work with children and parents, including assessments and parent work for babies and toddlers. Now, Natashia and I both have PhDs in clinical psychology. We both have advanced training in neuropsychological assessment. I actually met Natashia for the first time when I was on internship. I was still in training. I went to internship at Interfaith Medical Center and in Bed-Stuy, the Bed-Stuy neighborhood in Brooklyn. And Natashia was already there actually as a staff psychologist. So she was actually my supervisor during that year. I left to go and do clinical research at NYU. That's where I thought that I wanted to spend the rest of my career, but it turns out I really didn't want to spend the rest of my life with a grant application hanging over my head all the time. So I'm very happy to have left academia, and I opened Small Brooklyn Psychology as a solo neuropsych practice in 2013. Now, after Natashia left Interfaith, she did evaluations for the DOE in private practice, and she was working with doing rehab neuropsychology at Kingsbrook Jewish in their traumatic brain injury unit. She later moved as a senior psychologist to Rusk Rehabilitation at NYU Langone, and she was there for over 6 years before she very generously agreed to join us here at Small Brooklyn. And it was awesome. Thank you very much. Unfortunately, when Natashia joined us, it was literally the day before we had to shut down due to the COVID pandemic. So it was definitely a trial by fire for her. I'm so grateful that you've been so flexible, so positive, so graceful under pressure. So thank you very much. I feel very lucky. So this is the fourth webinar in our monthly series. Recordings for our previous talks are on our website at smallbrooklyn.com/services/talks. This series is actually media sponsored by Park Slope Parents, who are awesome, and we're just so grateful for their presence in Brooklyn, as well as their webinar platform. If you live in Brooklyn and you are a parent, I highly recommend that you join Park Slope Parents just for all of their amazing community that they've helped to build, as well as resources like this one, helping to bring information about all kinds of topics to all kinds of people. The series is also media sponsored by Premier Pediatrics. They have locations in Brooklyn, Manhattan, and the Rockaways. So thanks so much to them both. And I just want to put in a plug to stay tuned for our next webinar, which is going to be March 10th. When Jill DePietro and Maddie Lawler are going to talk about how to handle child meltdowns that stem from anxiety. And we will send out the registration link for that pretty soon. We'll get it up on the website. All right, during this talk, if you have any questions, type them to us in the Q&A. If you see at the bottom, there's a little sign that says Q&A. Because Natashia and I are going to be talking, we're probably not also going to have the bandwidth to read the questions like in live at the same time, but we will definitely save questions for the end, and we'll try and get to as many of them as we can. Okay, now you can go ahead to the next slide. So you were ready. You're ready. Okay. All right. So when people call us the first time, a lot of them come saying, my kid's teacher said I have to get him evaluated. I don't know what that means, and I don't know why I should do that and what I'm going to get out of it. So that is kind of the setup for this talk, is let's find out what is a neuropsychological evaluation, what is the point, what are you going to get out of it, and all the nuances that go along with it. So teachers are one place that the suggestion for an evaluation starts from. But the referral doesn't always come from a teacher. lots of times parents come to us saying that they're the first ones to have noticed that there might be something wrong with a child. Um, they they might have even gone to the teacher at some time in the past and said, I've been noticing that, he just takes so long to get his homework done, or she really can't focus and she's just, staring off into space so much, or he is having giant meltdowns. And the teacher might even say something like, I don't see what you're seeing. He's a completely different kid at school. Or they might say, well, sure, yeah, maybe he's having a little bit of problems there, but it's fine. And this has always been a bit of a nagging question in your mind that it doesn't quite seem fine. And I wanna be sure. Um, and then of course, neuropsychological evaluations are not just for kids either. Adults often come to us too saying, listen, I've always had this problem, or I have this new problem, and I want to find out more about it. I want to, I think I might be on the autism spectrum, and I feel like this would really help me to understand why I keep having problems in relationships, et cetera, et cetera. So these are the kinds of things that people come to us about. So let's talk about what it is. Oh, right. So you start with a Google search because everybody goes to Dr. Google first to find out what might be happening. And through the magic of Google AdWords, I hope, because I spent a lot of money on that, hopefully it's bringing us up in one of the search terms, that we do evaluations. And so what is an evaluation and what is the point? So I like to think of an evaluation as integrating a constellation of data points. When we do an evaluation, the whole point of it is to gather data from as many different sources and contexts as we can, in as many different domains of functioning as we can, until we have this 360 constellation of points that make you or your child who they are. And so we integrate that constellation into a recognizable picture and something that then we can communicate to you in a way that actually makes some difference to be able to say, oh, yes, I have been having problems with this my whole life. And this is so helpful for me to understand why. That's really our goal. So integrating the constellation, it's important to see that when we're doing this, our aim isn't to tell you necessarily whether your kid has ADHD or not. That is often a question that people are coming to us to answer. Do I have this diagnosis? And that will be one of the things that we tell you in the course of the entire evaluation that we're doing. But the bigger picture is describing your or your child's particular way of being and how the whole system interacts to produce a totally unique person. All right, so then a slightly different way of thinking about this is the mixing board analogy. This is kind of how I tend to think about it in my mind. So you have a little bit less of this thing and a little bit more of this thing, and it's filtered through this effect. And then once you have all that together, your music is going to sound very different from somebody else's music. And it's all based on those little minute changes in the input. I'm not a sound engineer in any way, so I'm probably totally butchering this and I apologize, but this is the way I think about it in my head. So our job is to measure the sliders and the dials. What are your strengths? What are your weaknesses? What are your idiosyncrasies, and how do they fit all together? And then based on those specific traits and skills, we help you find your roadmap forward. Okay, next slide. So now, after all those flowery metaphors, let's get more concrete. Because the truth is that while an evaluation is a fantastic tool for learning a lot more about yourself or your child, most people, and I highly recommend it for anybody who has the time and resources to do that, but most people seek out an evaluation when something has been going wrong. So, the sliders on the previous page, actually, can you go back to the previous slide? I'm sorry. These sliders, they really encompass the entire range of ability on a given trait. So for example, being able to easily and correctly interpret what someone's facial expression might mean. At the low end, you might not be able to derive any meaning from someone's facial expression. All the way up to, wow, it seems like this person can just read my mind based on what's on my face. Um, and that might, the large part of that is just normal human variability. And it is the parts on the edges that are the things that that might indicate that there is something different going on here. And that is all part of the bigger picture that we are looking at. So if only the facial expression interpretation slider is low, but the others are all high: conversational flow, understanding of vocal tone, intuitive sense of how to put someone at ease, then that's, something to note about yourself. Hey, I have a really hard time interpreting facial expressions. There might be another reason for that. But for the most part, it's just one of those quirks. We all have a difference. We all have variability in our strengths and weaknesses. But if several of those sliders are low, and they're all pertaining to, for example, your comfort in engaging in social communication, plus you have some other low sliders in like executive functioning, you have some high sliders in sensory sensitivity, need for routine, then that constellation of settings might suggest an autism spectrum disorder. So it's our job to notice those constellation patterns and then explain them back to you in a way that you can really understand. So our recommendations on what to do about that are going to change based on how the sliders change. Okay, now Natasha, you're going to do the next couple of slides.
Okay, excellent. So the shape of an evaluation. So the biggest question here is what makes a comprehensive neuropsychological evaluation? And as Mandi was saying, we really want to understand the whole picture of who you are, not just a little bit here, a little bit there, but really combine all that information to see really who the full you is, who your child is as a whole, not just little parts. So an evaluation is really important to understand not just who you are also, but also what the best treatment options and recommendations would be in order to improve your life, improve academic experiences, improve your experiences at home or your child's experiences within either environment. And how does this really make, how do you choose between a neuropsychological evaluation and, let's say, a psychoeducational evaluation? A psychoeducational evaluation can be offered by the school, and a lot of times through the school, it's free. One thing that's important to know, especially about a psychoeducational evaluation, it really is a narrower focus in comparison to what a neuropsychological evaluation would do. Usually a psychoeducational evaluation focuses only on IQ and academic skills. However, a child may not have any difficulties in reading, writing, or math, and not have any intellectual deficits, no difficulties with, let's say, working memory, which is kind of like a shorter way of looking at attention skills. But you know what? They may also have difficulties with executive functioning or longer attention. And so or there may be psychological symptoms like anxiety or depression. So what's really important about a neuropsychological evaluation, especially in comparison to a psychoeducational evaluation, if you're thinking about any type of academic difficulties your child may be having, is that a neuropsych really gives a broader picture and looks at a number of different areas that could potentially cause any difficulties within school, whether it's not wanting to do writing activities, walking around the room while the teacher is talking, not socializing with their peers. It really is a much broader focus, and that's really important to get the most accurate understanding of who your child is, and also if there's a diagnosis that comes out of it, the most accurate diagnosis. There are also behavioral evaluations that are also very narrow, where they really focus on maybe social skills, mood, but they don't really take into consideration maybe any educational difficulties the child may be having. And the same as can be said for psychological evaluation. It definitely is more narrow, more focused, whereas a neuropsychological evaluation is really much more comprehensive, and it takes into perspective a number of factors like developmental history, IQ, attention skills, thinking speed, impulse control, their ability to be mentally flexible, as well as mood. Is there any anxiety? Is there depression there? All of these things are very important. And lastly, as it relates to a forensic evaluation, usually that's something that's ordered by a court, and it has a very specific and narrow focus. So a lot of times there will be a forensic evaluation that's requested in a custody hearing. That's not necessarily something that a neuropsychological evaluation focuses on. However, we look at different parts of who a child is. If there is a custody disagreement, and you want to understand why your child is withdrawn, sometimes a neuropsychological evaluation can have more of a therapeutic focus and looking at coping skills, mood experiences, relationship style. All of those things are really important. And those are things that can be useful, not just for the parents, but also if the child is in therapy and to broaden their understanding of who the child is. So that's in some ways a brief a way to describe what a comprehensive neuropsychological evaluation is.
Let me
Um,
also add one thing to that, which is really another nuance thing that a neuropsych does well that I think none of the other evaluations do is really this connection between brain functioning and behavior. And so we have additional training in brain structures, neuroanatomy, neuroanatomical functioning, and to be able to connect particular problems in particular pathways that lead to, say, larger skills. So, for example, writing is a very complex skill that requires a lot of different um, pieces along the pathway in order to get to writing. You have like seeing the paper, you have thinking the language and understanding what it is that you want to say, you have forming the letters in your mind and then using your hand to actually write them properly, organizing your thoughts and actually getting it down onto paper, using good grammatic mechanics and things like that. So there's so many different areas of functioning that lead to something complex like writing. So having a more neuropsychological understanding of all of those different pieces can also help us to predict other problems that might come down the line, so that if you are having problems in this particular area of brain functioning, even if you haven't yet seen skills problems, deficits in a particular behavior, you might later, simply because they're intertwined in the brain. So that's another benefit. Oh, and that it's particularly useful for brain injuries, for example, and acquired brain deficits that might be related to another issue that you might have, like dementia or schizophrenia or HIV. Those all have impact on brain functioning too. Okay.
Absolutely, absolutely great. And one thing that often comes up, and a question that a lot of parents have, is how does an expensive and private neuropsychological evaluation differ from the free evaluation that's offered by the DOE? And honestly, it's a very different process. It's far more in depth than what you would get from the Department of Education. We're able to use a number of different measures and look at not just the subtleties and nuances of what your child is experiencing and other factors that may be contributing to any difficulties they're experiencing, but really looking at a number of different factors like history, personality, developmental difficulties, academic structure, class structure. All of those things can play a role in understanding what's going on with your child. That unfortunately, because the DOE is really stretched thin, they don't have the time or the resources to really explore what's going on with your child. So it's very much very much so a shorter evaluation and much more narrow in comparison to the time that we spend in trying to investigate what's really happening with your child. And also, in addition to that, the DOE can tell you where the deficits are. Potentially, like I said, it's not as thorough of an evaluation. So a lot of times there's information that's missed, unfortunately, but they're not able to diagnose. And that's something that's really important, because a diagnosis cannot just give you services, but also open your world to a number of different factors and understand why these deficits are happening. But also with that information, treatment can really be explored in a bigger and broader way. And as we were saying before, it's definitely a holistic experience where we want to understand who your child is, not just in school, but also outside of school. How are they when they're on the playground? How are they in your home? How are they when they go on play dates? All of those things are really important in order to get a full picture of who your child is, and really with the goal of not giving an inaccurate diagnosis. We want to give the most accurate diagnosis if one comes up, but are really the most accurate understanding of who your child is and what's happening and why. So who can conduct a neuropsychological evaluation? It's always a clinical psychologist who has a PhD or a PsyD, and they have a lot of specialized training in neuropsychological assessment. So they have years of experience in school, of course, but also they have received a lot of training with other neuropsychologists to really focus and enhance their abilities. And of course, they have additional continuing education experiences that broaden their understanding and keep them on top of different research or clinical information that could be really helpful for your child. So those are the individuals that are going to be doing the evaluation. And knowing how to perform the test really isn't enough. So it's, anyone, not anyone, but a lot of times people can give a test, but the reality is the most important aspect of giving a test is to be able to interpret the information. And with training and the skills that tie together to understand who your child is, that comes with a lot of experience and a lot of history and a lot of collaborative efforts between neuropsychologists to really create a broader understanding of who your child is. So like I said, it's not enough to really just analyze the test results, but you have to be able to incorporate that information to with your child's history, whether that's developmental history, birthing history, their current functioning at school versus at home, and looking at previous records from occupational therapists or other therapists or from the school to really understand, okay, what's the pattern? Is there a pattern here? What is that pattern and why may that be happening? With an evaluation, it's a multi-step process. So the first part is always to do an interview with the parent to really get a full understanding from their perspective of who their child is and why they want the evaluation. It usually
Or a
takes
clinical interview with you if it's an adult who's getting the evaluation for themselves.
Absolutely, sorry about that. Yes.
No, that's okay.
So that it could be, like Mandi is saying, it could be a clinical interview with an adult if they're the ones that want the evaluation, or with the parents if they're the ones looking for the evaluation for their child. And it usually takes about an hour and a half to 3 hours in order to do that evaluation. And we cover a number of different areas, including birthing experiences. And usually that's trying to figure out were there any type of injuries that could have occurred during the labor or delivery process or in utero experiences. Also, we want to look at developmental history to see if there's any delays or if everything was on time or early for learning early skills, language development, things like that. And also looking at medical history. Medical history is extremely important because if there is a history of, let's say, seizures or concussions or ear infections, that could really make a difference in how we understand what's going on with your child. For example, if there's a long history of multiple ear infections, that could be why your child is not developing language at the rate as their other peers, as opposed to autism. So it can really, all of this information really helps with what we call differential diagnosis. We always come to the table when we're talking to you during that parent or clinical interview and try to figure out, okay, what are the potential difficulties, what may be a possible diagnosis, but then ruling in and ruling out different conclusions based on the history that you're providing. And aside from birth and developmental history, we want to look at school history. What were your if for yourself or for your child, what were the experiences in school from pre-K or or even in daycare and beyond? Were there any difficulties with reading, writing, and math? Let's say the difficulty was with math and with reading. Was it mostly related to reading, or is there a math deficit that's there? So those are things that we'd eventually look at, but we'd also want to see common themes or try to figure out what the common themes are as it relates to any academic or school difficulties. And that also relates to work history for individuals that are adults that are coming to us for an assessment. We want to understand, are these unique difficulties that just happened now or more recently, or is this a pattern that's been happening since grade school or high school and beyond? So we really want to understand not just who the person is, what are the patterns that have developed over time. Social development and relationship history is very important for adults and for children. Are there difficulties in communication? Does the person seem to be more shy or not know what to say in a conversation? Are they withdrawn? What are the potential reasons for that? Do they have friends? What types of friends do they have? Do they have friends that are based on their specific interests, or do they have a broad range of friendships that are not, or are they only online, or are they in-person friendships? All these things are really very important for us to understand. As it relates to emotional and behavioral traits and interests, it's really important for us to understand, is there any anxiety? Are there any fears or worries that could potentially be impacting school or work or home life? Are there any behavioral traits? Is the person really shy, isolated, and withdrawn? Do they know how to cope with different stressors? Or do they not know how to react and become impulsive or angry as a result of any type of stress that comes their way? And also, what are their interests? And interests are really important, especially as it relates to who we are as people, because it can tell you a lot about a person, what their hobbies are, where they spend their free time. And also, as it relates to autism spectrum disorder, sometimes people have very specific interests. And if their interests don't deviate, that can give us a lot of information in terms of making an accurate diagnosis. And then lastly, previous interventions and psychological history are important. We don't want to create a diagnosis or recommendations in a vacuum. If someone has done psychotherapy in the past, it's important for us to know that and also know what type of psychotherapy has been done and if it's been effective. If let's say, for instance, if you or your child has done psychotherapy several times in the past, but it hasn't really been that helpful, that may be when we also recommend another type of intervention, whether it's a therapy that's specifically focused on their current issue, or is it something a little bit broader where we may want to add psychotropic medication to help with easing anxiety or difficulties with attention or monitoring one's emotions. So all of that is really important for us to really understand, not like we're saying, which is the theme, who you are, who your child is, but what are the most important interventions and recommendations that we can make, because that's really why you're here. A classroom observation is also important. Jump to the bottom, which is basically, we love to do classroom observations, but obviously it's very difficult in the time of COVID for us to do so. And usually what we had done in the past was we would sit in a classroom with your child for an hour before the testing date so that they wouldn't feel self-conscious about us being in the room. And we'd also get the most accurate impression, because if we're in a classroom with a bunch of children, we could be looking at or assessing anyone or their teacher. So it was really a great way for us to get a nice snapshot of who your child is, not just based on the teacher's impressions or your impressions, but also for us to get a more objective view of how your child is doing. But unfortunately, it's just not possible now with the pandemic, but hopefully in the future, that's something that we'll definitely be able to start up. And direct testing days, they usually are 1 to 4 testing sessions full day sessions that encompass about 4 hours with an hour break for children. For adults, we tend to make shorter sessions because the evaluation is more targeted. So it's one day of testing for 4 to 8 hours total. Testing can be done in person and in our offices because that really gives us the richest data. However, we are also able to do virtual testing when needed. So if that's something that's preferred for a number of reasons, whether it's distance or medical reasons, it's definitely an option that we can provide.
Let me
Uh,
also say that for the youngest kids, so one of the questions that has already come up is what are the age ranges that we do the evaluations for? And really, we can do evaluations down to 12 months. At that age, it's more of a developmental, observational evaluation that can help to make sure that a child is developing in the way that they're supposed to. But so from like babies through say age 4 or 5, our testing sessions are typically much shorter. Sometimes the parent is there, sometimes we're able to do sessions with only the kid, but we might be only looking at an hour at a time or 2 hours. And then once they're more at like the 6 and up range, they can usually do a longer chunk. So we usually end up doing like 2 hours of testing in the morning, an hour break for lunch, 2 hours of testing in the afternoon, and then we do that on 2 different days. An adult typically has more stamina. So like Natasha was saying, a lot of times we can get it done in a single day, but it might still be the same amount of time. It really just depends on what it is that the adult is looking for out of the evaluation. Go ahead.
True, very
Thanks.
true. And with all the testing that we do, we want to compare who your child is or who you are to other people in one's age range. So it's really important for us to compare, okay, what are most kids able to do at this age? Or what are most adults able to comprehend? And all of this information is really important to just get a baseline and figure out where you are. Are you in the average range? Or is your child in the average range? Or are you at either ends? We also do the testing in a really quiet environment. And it's the best way for us to get the most out of a child, but also the best possible performance. And with that information, we're able to look for any types of errors that the child is making, see how they deal with frustration, figure out why they're behaving in certain ways. Do they tend to be more impulsive or hyperactive or fidgety during math tests, or things that are less boring or more boring to them? Or is there a little bit more variability? So there's a lot of rich information that comes from us doing testing with your child, and especially within the room, because we have a really broad understanding of what kind of makes them tick or what helps them really focus and be really engaged. We also conduct interviews with other people because, like we were saying before, it's important to have a really broad understanding of who you are or who your child is. So, with children, we tend to interview their teachers, their therapists, or any service providers that are working with them currently. With adults, we might want to include a discussion with their significant other, or a parent, or a therapist to really understand to get more information about nuanced experiences, because sometimes other individuals have a different perspective, and that can be really helpful and informative for us in really understanding the full picture. And then in addition to conversations, we'll give questionnaires to you, or if you're for yourself or for your child. And also some of these are personality measures. So it allows us to get a richer understanding of any type of anxiety or depression, or why that's occurring. As well as personality, attitudes towards school, attitudes towards teachers, and attitudes towards life and social experiences. So those are some of the things that we use the questionnaires for. And it's, like I said, it's for yourself, if you're doing it yourself, or for the child, depending on their age, for the parent, and for any informants, like a teacher. We would ask them to do questionnaires. And the report we really make it, Mandi has done an amazing job of making an easy to read and easy to understand report that's really informative and helpful. I've been doing this a really long time and I've never seen such an amazing and helpful report. And that's something that Small Brooklyn is known for. I can't tell you how many times I've spoken to therapists and teachers on the phone about how well they know of the fact that they know of Small Brooklyn already because they've read other reports, and the fact that
Thank
the
you.
information has been really helpful. Oh yeah, it happens all the time, especially by the time I get to the feedback session. So that is what Small Brooklyn is really known for. It's not a flat report that anyone can write. It really does integrate the information. It tells you strengths and weaknesses of who you are or who your child is. Sometimes, if necessary, a formal diagnosis is reached and there are targeted recommendations. It definitely is not, okay, this is ADHD. We think your child should have medication. It may not be something that we recommend, but also in saying that, it's really important for us to figure out what are the family constellations, what are the family dynamics, who is this child in school versus home, and what could potentially be really helpful. So the report is just as important as the testing experience to really understand who your child is and to really sit with that information and have that information when we're not around to answer your questions, even though we're always easily reachable and we'll always respond to any questions. But sometimes it's just nice to sit with the data that really explains what's going on with you or your child. And like I
And
was saying,
one
oh, go ahead.
and one thing I've heard parents say over the years is that it's kind of a living document, that there are things in the report that might not fully resonate for someone at a particular age, but that they keep going back to the report year after year and rereading it and then finding more that they didn't really notice before, or that is all of a sudden really relevant that wasn't at the time. And so it has that longevity too, to help understand a kid or an adult over time as well.
Absolutely, it's very true. And especially as it relates to recommendations, what kind of treatment program is important? What kind of person should I or my child work with? What are the top priorities for recommendations? What kind of school is my child best suited for? What services or accommodations could really be helpful so that my child can receive the most out of their academic experiences? And what nuances should teachers look out for in terms of if there's a writing deficit? Where are those writing issues coming from? Is it coming from difficulty with handwriting, difficulty with processing visual information, or generating ideas to put on paper? So all of these things can really be helpful for you to learn about who you are or how your child is um, in moving forward. And the feedback session is usually it's one of the last things that we do. So after the testing is done, the report is written, we send it to you. We ask that you read it, and sometimes most parents read it at least twice to really digest the information, but sometimes just once is necessary. And it really is a time that feedback session is also usually done virtually at this point, and it's an opportunity to just really hone in on what those recommendations are, answer any questions that you might have about what your child needs, and to kind of go back and forth so that you have a good sense of what should happen next, how, as well as when. And any idea, any information that we can provide to you about service providers, academic supports, things that the school should know, any questions, that's a really great opportunity for us to discuss those things with you. Um, and the possible services that can occur are an IEP meeting, which is provide services and accommodations for a child in school, an impartial hearing where we could testify about testing and the need for a special education school, especially if the parent would like for the child to go to a specialized school as opposed to a public school. We can communicate that information to others, whether that's to the child in a feedback session or a therapist or another psychiatrist that they're already working with. And then we also offer future consultations or testing if there's a need for additional information or more support in a different way. What skills and traits are assessed for? Intelligence, which is reasoning and logical abilities, academic skills in reading, writing, and math, because they really are the foundational elements of all academic tasks, motor coordination, thinking speed, problem solving abilities, strategies for approaching life, attention and impulse control, language skills, memory and learning, personality, how do they cope with life, do they tend to be shy or more extroverted? And also social, emotional, and functioning, which is how good are they at communicating their thoughts, but also understanding the facial expressions and the underlying emotions of what other people are expressing to them. And in the end, the evaluation should really uncover strengths and weaknesses, cognitively and psychologically, help you understand any patterns of behaviors, styles, as well as help predict future successes and challenges. That can be extraordinarily helpful in moving forward to prevent any type of hiccups or decompensation or difficulties that could arise from choosing a school that's really not a good fit for a child, or choosing an occupation that's really not a good fit for oneself. So it really does cover for adults and children. And it's important for us to really have a clear understanding of your child's approach and functioning and recommendations.
So we thought that we would end with a couple of examples of different kinds of referral questions that someone might come to us to get more information on, and our approach and what we might find. So, for example, you have a third grade daughter. She used to melt down at school quite a lot, even before the pandemic. And now that she's virtual, she refuses to sign on to Zoom and she won't do any work. So, as Natasha said earlier, one of the first things, as we're gathering those initial stages of information, we are making hypotheses about what might be going on. And so, some of the things that we might be thinking about as we are listening to this set of problems are things like learning disorder issues, anxiety, depression. It could be emotion dysregulation. It could be uh, social anxiety. So as we're doing the testing for this girl, we actually find that she's got quite a significant reading disorder. And it makes her confused and embarrassed. In third grade, kids are starting to really compare themselves to other kids, and she's realizing that she's a much slower reader than a lot of other of her friends. So she feels really embarrassed. She thinks she must be stupid, and it's creating a lot of comorbid anxiety alongside that dyslexia. So, as part of our report, we're going to suggest some psychological treatment to bolster her self confidence. She might, depending on the severity of the reading disorder, she might benefit from a school for language based learning disorders. But we will certainly make some recommendations for reading interventions in the school, accommodations in her work, and possible, and then strategies for parents at home to really understand the difficulties better and help her to cope better with her embarrassment and avoidance.
Another example can be of a child who has a suspected autism spectrum disorder. So some of the initial concerns could be that your teenager is socially awkward, has no friends, refuses to attend in-person school, hates showering, and needs a lot of encouragement to start schoolwork. So a couple of things that we look for would be anxiety. Is that a factor? Is it depression? Is that the reason why your child doesn't want to go out and participate in school and not have the energy to do so? Is it ADHD? Is it difficulty really with focusing and concentrating for any period of time to information that's coming in? Is your child a little bit slower in picking up on information and social cues? So does that make your child socially awkward and make any discussions with their classmates difficult for them? And is that why they don't want to go to school? Is there a learning issue? Is there difficulties as it relates to math? And that's why they don't want to go to school. That's why they start to feel a little bit anxious and depressed. Or is it autism? Is this a factor in terms of the fact that they can't relate to their peers, and is it really depressing them? So testing finds that it's autism and anxiety, which tend to coexist quite frequently together. And part of the reason why that she doesn't know how, part of the reason why she doesn't want to go to school is because she doesn't know how to respond to kids when they make small talk. She can't figure out what to say next and how to continue the conversation. And she feels that other kids are making fun of her, and that's creating even more anxiety and even more social difficulties and fear of interacting and going to school. So what's really happening with your child, and some of the things that we'd recommend from that point are psychological treatment like psychotherapy to build social skills. So that could usually include group work to improve another group with other girls or girls and boys to improve social skills. Also identifying and practicing strategies to maintain anxiety. And a lot of times that's done in individual psychotherapy, and encouraging attendance of a specialized program for students with autism, the NEST program. And there are other programs within public schools and some private schools to help with individuals who have autism spectrum disorder. So those are some of the recommendations that we would be potentially making for anyone who has autism.
Our next example is an adult who's underperforming at work. So an adult man took a checklist online, and based on that blog post, thinks that he might have ADHD. He comes in saying, I've always had, or really recently, I haven't been able to focus on my work. I can't get anything done. I think I must have ADHD. So we will certainly look at executive function issues currently, but also in the past. One thing that's really important about ADHD is it is a neurodevelopmental disorder, which means that it's really existed throughout development. And current criteria for the diagnosis say that you need to have been experiencing this since before age 12. The issue with ADHD and executive functioning in particular is that executive functioning is something that is impacted in almost every psychological diagnosis that we know. So if you are only measuring difficulty with executive functioning, it might be ADHD, but it could also come from lots of different issues like an unrecognized academic or learning issue, anxiety, trauma, mood disorders, autism spectrum disorder, and then more serious things like psychosis and bipolar disorder as well. So as we're going through the evaluation, we find that the data suggests it's anxiety, actually. A lot of times that obsessive worrying and rumination and the voice cycling inside your head can make it really hard to focus. A lot of people with anxiety tend to be perfectionistic, and some of them end up sabotaging themselves in an unconscious way, that in a way that can look very much like ADHD. So that's one of the reasons that it's important not to only look at a small slice of behavior, but to really understand all the pieces that are going into it.
And lastly, let's say there's an older adult who with declines in their functioning. So so they're having a hard time remembering names. They've forgotten to turn off the stove several times. They've gotten lost on their way home, and they shower less frequently. And that the reason for that could be a number of things. It could be anxiety, newfound anxiety from any changes in life, or depression. It could be situational stress related to work or family changes, or it could be dementia. And so let's say that the testing that we do finds that it's Alzheimer's dementia, and the difficulties are expected to worsen over time. So we would definitely suggest working with a neurologist on medications that can slow the process down a little bit. We'd recommend cognitive rehabilitation to practice different cognitive skills and everyday living skills. Identify supports who can help out with daily experiences like cooking or cleaning, and especially bill management. All of those things are really important to try to figure out how to prevent the worst case scenario from occurring with an Alzheimer's dementia. And then also sometimes we're able to find different clinical trials that people would be really well suited for. So those are some of the things that we'd recommend as a result of the evaluation.
So we have covered a lot of information here tonight. We have a lot of questions in the Q&A, so I'm going to tackle those. But if there's anything that we haven't been able to answer for you and are not able to get to in the question and answer, I think we'll probably go a little bit beyond 9 o'clock just to try and get to a lot of these questions. If you do have questions, by the way, put them in the Q&A so I can get to those. But if there's more that you want to talk about in a more in-depth way, please feel free to reach out to either Natasha or me, or to our general email it's hello@smallbrooklyn.com, and our website is smallbrooklyn.com. Feel free to read all kinds of things, all kinds of information about how we approach neuropsych assessment for specific problems and generally. All right, so let's talk about some of these questions. If somebody is not looking necessarily for a diagnosis for their child, but just interested in learning more about the kind of learner that the child is, or just more information about how their brain works in order to support and strengthen them, is that something that we do, Natasha? And what do you do with that kind of information?
Absolutely. So I think everyone coming, as Mandi was describing, everyone has things that they're really good at, things that they might be a little bit weaker on. And those are things that can come out and that will come out definitely in testing. And so we can really explore you or your child from different perspectives, looking at reasoning skills, academic skills. Are there any areas of slight weakness as it relates to reading, writing, and math that we should investigate more thoroughly? How is you or your child's memory, executive functioning skills like impulse control, mental, how flexible they are in everyday life experiences, and also looking at mood, coping strategies, relationship style. All of those things are really important. So that's absolutely something that we would be able to do and have done.
And yeah, and getting that information, even if it doesn't lead to a diagnosis, can really be helpful for you or for your child to be able to put themselves in good situations that are going to play to their strengths, help them to anticipate any issues if they know that they do have to do something that isn't their strong suit. So for example, one of the things that is a little bit more subtle issue that comes up is this idea of processing speed. Natasha talked about it a little bit before, but if our speed of being able to notice and then process, respond to things is different among different people. And if you or your child is on the slower end of things, it just takes you a little longer, and you need to allow yourself some time to fully process everything. But if you're in an environment that is very fast paced and lots of things coming at you at once, it's probably going to make you feel very anxious. So you might not need a diagnosis for that sort of thing, but knowing that, hey, you need to allow yourself some extra time, especially when you're in a novel situation and you might be stressed about it, that can actually be really helpful. So we can make very targeted recommendations about stuff like that. Some people are asking about timing. So not just the age ranges that we see, which is really all ages, but also when's the right time for a child to get an evaluation. And honestly, I think that answer really comes down, it depends. And I know that's the worst answer because it's such a non-answer, but it really does. If you feel like there's a problem and especially if it's causing impairment in some way, whether it's emotional, behavioral, academic, and you want to find more information and help, and help provide support for your child, then a neuropsychological evaluation is always helpful. There's differing levels of information that tend to come out of an evaluation depending on what age the child is. So like I said, when we're working with babies and toddlers, a lot of times it's very focused on developmental stage, observation of like, are they interacting with others? Are they picking up blocks, and how's their gross and fine motor development, things like that. Ages 3 and 4, we're really looking at much more like pre-academic skills, very, very early executive functioning. There's not a lot that we can test in executive functioning, for example, in a 3 or 4-year-old, but there's a lot related to development and language that we can still get. Elementary school kids tend to be a little bit more, their academic skills tend to be a little bit more fleshed out, and we can do some really good targeted targeted academic testing at those ages. But there's no real right or wrong time to do all of those things. It really depends on how much is it needed. If you are seeing a problem and you need help for it, then waiting is not gonna, it's not a good idea. With a lot of academic issues, for example, the earlier that you can get interventions, the better the outcomes are. And then sometimes there are considerations like the fact that most of the time the DOE requires a 3-year cycle of getting evaluation. So they get reevaluated every 3 years. So if you want an evaluation that's still going to be applicable when they go to high school, for example, then getting it at the end of 5th grade might mean that you have to repeat it again just before high school. If you can wait until 6th grade, then maybe that evaluation would still be applicable when high school comes around. So those are some of the considerations you might want to think about. But in the end, it really comes down to, do you feel like there's a problem and you need help for it? And that's, then an evaluation could be helpful. And one of the ways that we try and help people answer these questions, by the way, is by doing a consultation. Like if you just want to talk it over with one of us and get some information about, like, is this something I should be worried about? And can this issue be addressed adequately in an evaluation? Then you can just, schedule an hour of consultation with us. And then you might decide to do an evaluation after that, in which case the fee for the consultation will actually get rolled into the fee for the full evaluation. Or maybe that will be enough to give you a good start, and we can suggest some strategies for now, and then you can go and try them and see if that helps. And then if not, you can always come back for an evaluation later. Natasha, someone says, I have an 8-year-old son who is struggling with reading and writing, but otherwise has no issues. He does well at school, is athletic, has no behavioral issues. Is there a test that would focus on identifying learning disorders only? I want to know if that's the issue. What do you think?
Absolutely. So part of that evaluation would include looking at reasoning abilities or intellectual abilities, and then doing a really thorough dive into what's happening in terms of reading and writing. Is it more of a visual spatial difficulty? Is it how quickly they're able to do those tasks? Is it any number of factors? So there's a lot of depth that we can do when looking at reading and writing deficits.
Lots of people are asking about insurance reimbursement. We are out-of-network providers. That means that you pay us directly, and then we give you an invoice to submit to the insurance company for reimbursement. That is unfortunately, it's only applicable if your particular plan has out-of-network coverage. So if you are on HMO, for example, and I believe all of the marketplace plans are all HMOs, and they do not, and Medicaid is the same, they do not cover any out-of-network providers. But if you do have out-of-network benefits, then an evaluation often is covered. What is not covered is academic testing. Insurance companies consider that to be the bailiwick of the DOE, and they won't pay for it. But as academic testing is a part of a larger neuropsychological evaluation, a lot of times it is covered after your deductible and up to whatever the negotiated percentage is, 60 or 70%. But many of our families do end up getting quite a large bit of it reimbursed. So if you are interested in it, please feel free to call us and let's talk it over, and we can send you a sample invoice with all of the codes on it that you can then use to go back and talk to your insurance company directly and ask them those very specific questions. We do offer some sliding scale slots at times. We can't do it all the time, but we do have some slots available. We also have, when we're very lucky and we have doctoral students who are working with us, what we've been able to do in the past is to do a highly supervised training evaluation that can be much cheaper, much less expensive than our typical evaluation costs. So we do not have a student with us right now, but I hope to be able to provide that service again in the future. Let's see. Are we doing in-person evaluations and individual therapy sessions? You take that one, Nat. You were the first one to go back to in person, actually.
Yes, we definitely are. And we try to be as careful as possible. So we have a plexiglass that usually is between us and the person that we're assessing. We also have a HEPA filter. We, of course, wear masks, and there's a sufficient amount of hand sanitizer in every room. So we definitely are able to do neuropsych testing as well as therapy with parents or with children or with a combination of both. So yes, absolutely. But
And
virtual
I
is still
just got my
an option.
second.
Oh, go
And
ahead.
what?
Virtual is
Oh, what
still
did
an
you say?
option for those that are interested.
Oh, right. Yeah. So when we're doing evaluations, we try and do as much that we can do virtually, we do virtually. So usually the parent interview, the feedback session, the interviews with other service providers, questionnaires, all that stuff that can be done at home. It's usually with adults, we do it virtually. And then, but the direct testing, we really like to try and do in person as much as possible. And Natasha talked about that earlier, but we really feel like it gives us a lot more rich data than being able to do it on screen. We can still do valid assessment on screen. It's just not what we would prefer to do if we can help it. And I did get my second vaccination dose just yesterday, so it's another point of reduction in transmission. I'm super excited about that. So some people are asking about doing, I think we've made a pretty good case for why comprehensive neuropsychological evaluations are helpful, and sometimes I think really needed in order to get a really good answer about what's happening with somebody. But can we do more targeted, more narrow focused evaluations, and when is that appropriate?
Oh, I'm sorry, it cut out. What did you say? I'm
Ooh,
sorry, it cut out.
my
Sorry.
bad. My
I think it's my
internet connection is
Wi-Fi.
not always. Ah, I was just saying, can we do more narrow or specific focused evaluations, and when is that appropriate?
Yes, we definitely can do really specific evaluations that are, like you're saying, more narrowly focused. If there's a question about any number of things, whether it's ADHD or autism, um, a lot of times people will request that if obviously finances are a factor, or if insurance is only covering a portion of it, so they want to limit the number of hours. But it is something that we can do. Sometimes we won't be able to answer all the questions or dive into all of the questions that we have as the testing progresses, but it definitely is something that we can do for sure.
How far in the future are we scheduling? At the moment, our next evaluations are scheduling in early April. That is probably going to slip pretty soon, just because this tends to be the time when everybody is very interested in getting neuropsych evaluations. So sometimes we can all of a sudden go from, we have openings in April, to like, oh, we don't have any openings till the end of May. So if you are interested, please do call right away. Would it make sense to have a psychiatrist evaluate and help determine what kinds of tests would be needed for our child before moving forward with a neuropsych evaluation? What do you think, Nat?
So usually psychiatrists are not trained on neuropsychological assessments, if ever. So they usually rely on us to come up with they always rely on us to come up with the battery, and they usually don't make recommendations, but they can give information about how they feel like the child is functioning or reacting to different types of medications, and also give information about what they think the potential diagnoses are, or what they've diagnosed with the child, but may have a little bit of concern about difficulties in other areas that are not covered by the diagnosis that's been given. So they always rely on us to identify what the testing material should be.
And the interpretation of it.
Yeah.
And any longer term provider that you or your child has been working with, or a psychiatrist, psychologist, or some other kind of service provider, is really invaluable to us to be able to get that information, like Natasha was saying. They've learned so much more just having worked with you for so long, a lot of nuance, and we want as much of that information as we can get. So we always want to collaborate with those people as much as possible. If you have an evaluation with another neuropsych practice, can we still do therapy in our practice? And absolutely. There's, we have lots of people who come in for therapy who've never had a neuropsych evaluation before, or have had a neuropsych in a different place. we are very happy to work with anybody. It's also quite common that someone will have a neuropsych evaluation with us, and the best kind of therapist to work with them is somebody outside our practice. And we've spent a lot of time making really great connections with fantastic providers outside the practice. And so we have a really large network that we like to refer to. So we can always help you find the best person, whether it is someone in our practice or someone outside of it. We are going to have to end in a minute, but I'm going to try and take one or two other questions. If we'd like to schedule a neuropsych eval, how should we do that? Reach out to me, probably, Mandi with an I at smallbrooklyn.com, and let me know that. Sometimes, if you're absolutely sure that a neuropsych is definitely what you want to do, then we can get you on the schedule, and no worries. If you still want to talk it over a little bit first, we usually offer a 15 or 20-minute consultation just to talk it over with me or Natasha or Nav, our other neuropsychologist, or our office manager, Taryn Boley, who's also very knowledgeable about all this and can describe the process for you. So we can certainly talk it through and make sure that it seems like it's the best next step. Sometimes it's just better to try a little bit of therapy first, and we will certainly give you that information if we feel like an evaluation is not the right step right now. All right, lastly, my 13-year-old daughter sees a therapist for anxiety and mild depression. She's struggled with executive functioning for many years, and it's gotten much worse during the pandemic. That is a very common story, unfortunately. We're considering a neuropsych exam in advance of starting high school. We've never thought that we needed one before because she's a great student, but remote learning has been a disaster and she's failing multiple classes. Do we think that a neuropsych exam done now during remote learning will accurately assess her problems? What do you think, Natasha?
I definitely think it can. So it could really help us better understand what are some of the factors that contribute to the anxiety and depression. One thing I've noticed, especially now, as Mandi was saying, since remote learning has started, anxiety and depression has really increased for a lot of kids. And a lot of them have been able to give me a lot of really helpful information to understand why they think those things are happening, what the history of those experiences are, and what to do in terms of moving forward. So it absolutely can be helpful and useful for moving forward in terms of understanding the big picture, and also really useful for the therapist in understanding, okay, what are their emotions, what's contributing to their emotions, what is their coping style, their relationship style, and maybe, every now and then there's something else contributing to the anxiety and depression other than internal experiences. So it's really helpful for us to flesh those things out.
And really, any time that you have to concentrate, but you have anxiety, whether it's pandemic related or not, and depression, it is going to get in the way of your ability to concentrate. And of course, for kids, that is school. And remote learning absolutely makes it even harder to focus and pay attention. There's a lot less of the social connection that helps to keep kids engaged, and they are better able to turn off their screens and zone out, and they have fewer of the social cues from their peers to be able to see, oh, that kid's still paying attention, maybe I better do that as well. So it may not be a learning issue at all that is now making your student have problems with remote learning, but it's the situation, anxiety, depression, all the things that Natasha was talking about. Thank you so much for joining us. If you have a question that was not answered, definitely feel free to reach out. Stay tuned. March 10th, remember, is going to be our next webinar. It is on managing anxiety-related meltdowns with Jill DePietro and Maddie Lawler, and we will get the registration link up on our website ASAP. We are also going to send out the link for the recording and a copy of the slides so you can have them for your records. Feel free to reach out to me or Natasha for any further information. And as always, thanks again to Park Slope Parents and to Premier Pediatrics for media sponsoring us. See you next time.
Bye. Have a great night.